So I offer two different types of implants. They are saline or silicone implants. The important thing to know about implants is the part that touches your body is made out of a silicone shell polymer, but the difference is what it's filled with. Saline is filled with salt water, silicone is filled with, now we have the gummy bear implants, which is a really cohesive gel. So those are the two types of implants. I only offer smooth round implants as the textured implants have been recalled and we don't use those anymore. So I would say like 95% of my breast augmentations are done through an incision in the fold of the breast, unless there's some sort of congenital malformation of the breast where I have to go through the nipple and potentially reshape the breast internally. But rates of capsular contracture and other implant complications are much lower by putting the implant in through the fold. So there's a couple different pockets where we can place the actual implant. One would be under the gland of the breast, the other would be under the pectoral muscle. Those are definitely the more common. There's a new-ish plane that we can put implants in called the subfascial plane. That's under the breast gland but on top of the muscle. And I really am starting to like that plane because you don't have the animation deformity of the pectoral muscle pushing that implant out into the armpit. Make an incision in the fold of the breast, dissect either again on top of the muscle, under the pectoralis fascia, or under the muscle. Dissect the pocket nicely. It's gonna be a nice tight pocket that fits that implant. I personally still use gel sizers to put different size implants in there to really see what fills out the patient's breast footprint the best. Also make sure it's aligning with their aesthetic goals. I then set them up. We check for symmetry, and then we sit them back down, wash the pocket out really thoroughly to make sure it's nice and clean. We don't want any implant infections. And then I use a no-touch technique. Almost looks like a beer funnel where we squeeze the implant into the pocket. Nobody, not even myself, touches the implant. Close you up, and then you're ready to go. It takes about an hour, hour and a half long surgery. For the most part, I'm using the gummy bear implants for breast augmentation at this point. The other really cool new thing that I'm using is the internal bra. There's a couple of different brands. Basically what that is it's soft tissue support for the implant when I'm doing just an augmentation. The implant goes in, the mesh goes under the implant like a hammock, and especially for those bigger augmentations where we're using a bigger sized implant, it really helps support that implant so that it doesn't drop too low. Because you want to think about your result over 10, 15, 20 years, just not in the immediate post-operative period, and that Galflex or Durazorb internal bra mesh can really help support that implant over a long, long time.